Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
Welcome to the Concussion Corner Podcast. My name is Dr. Jessica Schwartz, and I'm thrilled to have you here today. What happens when you blend Swiss precision, global perspective, and 35 plus years of sports physio experience? You get Dr. Mario Bizzini. In this episode, we go behind the scenes of the 2024 Swiss Sports Physio Conference, speak about the gaps in global concussion education, and explore how we build a truly interdisciplinary future for injury prevention and rehab, one passionate provider at a time. Welcome to our Teach One, Serve Many community. I'm so glad that you're here. Let's begin. Welcome back, Dr. Bizzini. It's so lovely to have you on the Concussion Corner podcast again.
Great.
Fantastic. So, in our first podcast, we talked a little bit about the FIFA 11 Plus and even some of the crossover of how that would work with concussion patients and rehab professionals on the sideline and pitch. I'd love to kind of transition over to, what you do so well, which is education. And, when we were talking in New York, when you were visiting at one of the Liberty games, we had this great conversation about really missing the in-person and the value of the in-person conference, which I can 100% equivocally say the Burn Sport Physio 2024 conference, and I hosted the Super Bowl concussion brain health conference for Lee Steinberg, which is like the original Jerry Maguire. It was the most professionally put on a conference I've ever been to. So just kudos to you guys at Sports Physio for doing it so well. But, really connecting to the importance of in-person. And then for myself, not only as a brain injury survivor, but also as a physical therapist in the US, the importance of, if we can't make in-person happen, I do this kind of hybrid bicronous teaching where we have on-demand and in-person components to make sure that we can access people all over the world. So I'd love to kind of highlight the Sports Physio 24 conference first. And really what the impetus was to have a brain and sport conference at your 22nd annual SSPA Sports Physio Swiss conference in 24 in Bern. I'd love to hear how you thought of the concept and then also how you picked the speakers as well.
Thank you for your nice words, and we are happy you enjoyed the time in Bern. So let's say the sports physio Swiss conference has always been trying to bring some good or excellent international speakers to Bern. If not, we did it also a few years online during the pandemic. And this, the idea to have brain and sports, it is per se nothing new, but it was, I think let's say the area neurocognition or neuroscience or how you want to call it. It's for sure one of the most important. There are many implications. It's not just let's say a specialty per se, but it has implication at any levels. And then also to include also the concussion topic was given. So it was I think it was a nice opportunity to include some very, very important topics. Just in one day, we could have covered more, I don't know, but I think many key topics were there. And for sure, it has been one of the most important conference over the years.
Fantastic.
And yes.
Yeah, and you had such a depth and breadth of faculty that spoke at your conference, of speakers from Dusty Grooms to Joanna Kvist to Suzanne Gard to Eamon Delahunt to Ava Agberg and so on. How did you guys kind of pick the and what was that process like for you in terms of integrating really from head to toe? It was really fantastic to see, and literally toe if you learned from Dr. Delahunt.
Yeah, this is maybe a bit easier for me. I'm many years there, and I know most of these speakers or colleagues personally over the years from conferences, mostly other conferences or projects. So we know each other well, and it's a pleasure to invite them. So then there is a little bit of work of preparing the program, but this has always been an easy task, let's say, for me, basically because of the good network over the years, let's say. And for sure, a big motor in this, in the whole neuroscience area has been the isokinetic conference from from the Della Villa's family, which has included this topic already in these last years, inviting Dustin and other people from Europe like Ali Gokeler, etc., to their conference to also because, let's say, one of the areas, as you know, has been neurocognition and ACL. So being the ACL and knee, one of the main topic of this cytokinetic conference, so all came together. But as we know, it has a much large implication than the knee. So that's it's not now that we have to say you have only to apply augmented neuroplastic programs or whatever, but you cannot neglect this, and you cannot to continue to do the same thing and not apply this knowledge. So there are ways of applying this new knowledge or new strategies also in simple ways. You don't need always to have very fancy equipment, but I think it's important to apply. You need to know about it, that this is the reason of having conferences, or to follow some quality education if you want to keep updated.
Fantastic. Just to go through a couple of the topics. And again, because we here at Concussion Corner Podcast, we want to make sure we're either giving 25% away of our academy to the public to make education accessible. And it's kind of fantastic to see that you're doing the same with this past symposium in 2024, which is actually freely accessible to folks on YouTube. And I think it's just a fantastic thing to see, to A, make things accessible, and B, also just to let people see how you throw a conference, which is, again, a gift in its own. But again, to highlight some of the topics, you had Francesca Della Via from Italy, an Italian physician, talking about the ACL injury through a neurocognition lens. You had Dusty Grooms from the USA talking about neuroplasticity after sports injury. Another highlight was from Joanna Kvist, integrating psychological aspects into ACL rehab. That was a fantastic lecture. Dr. Suzanne Gard, who's now the president of IFSBT, shoulder instability rehabilitation, no brain, no gain. I mean, what a fantastic lecture, really just looking everything from, proximal distal sequencing to really just getting the whole body involved and just making shoulder rehab fun. I gave a lecture on concussion complexities, persistence of post-concussive symptoms. And then we had Eamon Della Hunt from Ireland talking about neurocognitive aspects in ankle rehab, and then Ava Agberg talking about motifs, which was fantastic, the motor imagery to facilitate sensory motor relearning training, also called motifs, MOTIFS. What were some of the highlights for you, kind of seeing that conference kind of come together? For me specifically, just seeing people come up with either their own concussion stories or just, hey, we didn't know about X, Y, and Z. And it's so fantastic that we can now incorporate vision rehab or vestibular rehab or some of the cervical spine components that we learned from Dr. Trelevan about in our school. What were some of the key highlights that kind of, were important for you for that conference to kind of see come together?
Yeah, of course, to have all this group together, it's first highlight. And then they were all excellent speakers. And I think it's also not always easy to have speakers or colleagues that can also summarize and explain in a good, digestible way. And I think this is the case. The proof, just go back to the videos of the conference and relive this. I think some key messages behind that. It's not just ACL that we have all this knowledge. There is more, much more, and then that there is a way to apply it in an easy way as well. Maybe there is a need to have some training to you cannot apply everything at the same time. So you need to also to make your own experience on how to work. So, and also to appreciate working with a knee. Maybe it's not the same with a shoulder, or if you are into head and neck post-concussive symptoms, it's also another story. It's also important to know that your limits, that you may need to ask someone else. In some areas, you really need an interdisciplinary team. So concussion is a the best example of this. And I think this was the key message, I think, also for the attendees. Then you need to dedicate your own time to dig in a little bit more in depth. And as I said before, this is we cannot say it's an emerging area, the whole neuroscience. It has been there a long time, but maybe in this way also trying to explain some injury mechanism, or trying to have some strategies how to develop a rehab program, or to shape it in terms of augmenting neuroplastic adaptation. As Dustin says, a lot has been done, and it's still an evolving area, which is also very interesting.
Yeah, and I think it was fantastic for me, as a concussion human, to really see, Dusty Grooms emphasize that neuroplastic and cognitive adaptation, following musculoskeletal injury, really tapping into my love of ortho, being an orthopedic resident here at NYU, we're the first 6 in New York, to the concussion side of things, where I'm on that, really that ortho neuro physiological meld of all things that I've grown up loving from my educational background. But, really seeing the why and the how, and really having healthcare providers and especially physios really connecting to, we're not just going through the motions of these exercises. We're really connecting to that. Hey, these are brain centered, attention focused, and sensory integration. And we just had Dr. Julia Trelevit on not too long ago, really talking about sensory integration for that upper cervical spine, and really kind of looking at that 360 meld of everything that we spoke about at that conference was so individualized in terms of the silo of the shoulder, the ankle, the knee, the ACL. But then at the end of the day, there was so much crossover, and none of us really had a huge connection pre-conference about our lecture topics, other than that we just, every single lecture linked into the next. And it was really just a wonderful example of individually competent healthcare providers working together for a collectively competent, conference, and that had crossover. And I have to say, your 500 plus people that were in that audience were just leaned in and locked in for the entire day, Mario. And I have to say, you had people sitting in the back on the floor that were just happy to be there. So it was just a testament to how you guys throw a conference. So just thank you again.
Yeah, please. You had a great contribution, and you cannot do this without great speakers.
That's true. Yes.
As you and your colleagues.
Thank you so much. And, everyone loves a little behind the scenes conversation. I started this podcast because I was having these conversations over like an adult beverage or a caffeinated beverage at conferences all over the world. And, when you had called me up and said, hey, through Mary, who we all know and love in the sports physio community, hey, Jess, we have these issues in Switzerland with concussion education. And you were comparing some of the educational things that we have in the US regarding concussion. Let's kind of share that with the audience and kind of let them know that what we talked about. And I think it's a healthy conversation so people don't feel less than, because it's the same conversation all over the world in terms of access to a highly specialized that is complex, and we have to honor that a brain injury is complex. But in absence of knowledge, it's complicated, and patients often get mismanaged, which is why I started the Concussion Corner podcast, which we're in over 60 countries now. So thank you for coming on. And then we started the academy side of things, so we can individually train and group train one-on-one and in groups. So I'd love to kind of have that conversation of what do you feel is missing in Switzerland and or Europe in terms of concussion education for healthcare professionals?
Yeah, this is, let's say historically, I would say not only Switzerland, but Europe, everything related to concussion, we are probably 10, 15 years behind North America. For sure, there are reasons for this. I think nowadays it's, yes, it's important to know the concussion in sport, statement, CATs, and all this, but there is much more behind. You need really to, especially if you work in sports, and maybe also at I will not say only at elite level, but at any level, in contact sports, where concussion is one of the most common injuries. Then you need not only to be able to do the acute management, but also at least to know what comes next. And then education is the key. Of course, you can say, okay, I don't care. I don't work with this, but at least you should know the basic, let's say basic elements, and then you should know where to refer to best advise your athletes, because athletes are at the center. So at least if you are the professional there, you need to properly advise, and that's why educational programs are the key. And the and the best ones are from your country. So there has been some MOOCs from the Calgary group. You have your academy where we are happy to have this cooperation to offer a reduced fee for your academy for those interested. Anyway, it's very important to have this education. This is not something that we should just put on the side, because you are not professional in doing that. And then I think that also very important to know is that it is not a one man or one woman show, but is a teamwork. So I had personally the chance to work in different years in a sport concussion team, and really only thinking about PTs or athletic trainers there. So you need to have knowledge. Someone has more knowledge in return to sport. The other one is in aerobic testing. The other one more manual therapy skills. Another one more in headaches management. Another one all the oculomotor and visual and vestibular therapy. So and this is not finished. There are so many areas, and you need to have colleagues. Maybe you can cover 1-2 areas, but you need to have colleagues, and then you have the neurologist, psychologist, and other specialists. So it's really a team. It's a teamwork, and you need to know where is your place in that team.
Fantastic. And, I think we do the same thing here with, my role as program director is to say, you know what, we want to raise students that say, you know what, I don't know, but let me take the time to find out. And then we're exposing them to the top 1%, if not 0.5% in the industry for concussion, so that they can feel psychologically safe to ask those questions. Because we're going to talk about sport readiness all day long with BJSM and Dusty Groom's work and Suzanne Gard and all of that, the wonderful people that you've had speak in this past conference. And even just connecting to Dr. Grooms, to Dusty Grooms' lecture where he was talking about quad strength. Symmetrical quad strength doesn't protect from ACL re-injury if return to play is less than 8 months. So when we talk about, 1 in 5 pediatric concussions, 1 in 5 kids will have a concussion in their lifetime. 1 in 4 adults will either have or know someone who's had a concussion. And for me, I'm like, I want to talk to everybody. We just had pelvic health therapists come on the podcast because, again, I want to talk about the Eamon Delahunts talking about ankles, and I want to talk to the Ann Dukes talking about pelvic floor PT, because, again, if you have that pelvic patient that's coming in for pelvic PT and they're on the table and they just went skiing and they just had a concussion over the weekend and they're coming into your clinic and they're a little off, I want to make sure you know what? Let me make sure I make that referral right away, because we know that acute referral for concussion care and management is so important. And so many people don't know that concussion is actually a rehabilitative injury. And even BJSM itself wrote in 2017 that the injury of concussion is rehabilitative. And we as physios in this country, we just turned 100 in 2021. We started as rehabilitation aides, literally rehabbing soldiers in the trenches from brain injury. So we know that, they're rehabilitative. We can get people back. But again, that interdisciplinary conversation of low ego, here's what I can do as a physio, here's what you can do as a psychologist, athletic trainer, OT, physician, etc. And here's how we can treat together. So creating these really low ego environments with just, here's how we can serve the patient has just been such an honor to see. And the fact that we can kind of 360 and kind of pick apart some of the existing data that's already out there and just facilitate next day knowledge translation is such an honor to see through the podcast side of things, and the academy. So thank you so much for, broaching those conversations, because they're so important to have, because at the end of the day, there's over 43 working definitions of concussion, and only one of them is evidence-based, right? So it's like, how do we educate this and make sure that we're not telling our communities, hey, we can cure your concussion, because we want to say, what is a cured concussion? Are we looking at time-based, which the answer is no, we're not. Are we looking at reaction time? Are we looking at the 360, those clinical profiles of sleep and cervical spine and vestibular and ocular motor and so on and so forth, physiologic? And how are those pieces coming together? And for me, it's who better than a physio to look at that, but we need that team component to make sure that we don't have any cognitive blind spots, which so many times there are, and then those patients suffer.
Absolutely. Yeah. I can only say it once again. I mean, it's, of course, when you have more experience, many years of experience, you work in different areas, you can maybe be okay in some areas, but you need colleagues, you need teamwork. Many times we need to step a little bit back, a little bit of humility, and be just humble enough to say, okay, this is too much for me. I don't know. But I know Jessica, she knows more about this and that, and then she can help. Maybe she can not only me, but moreover the athlete or the patient. So, and that's how we should work together.
And I think that comes full circle as we wrap up this podcast is that, just talking about your early career from the last 36 years, all the way to where you are now working with FIFA and professional hockey teams, and obviously what you do and shine so bright at Sports Physio Swiss, of thinking about at the end of the day, let's make sure that we're connecting to, are we networking properly? Are we reaching out, sending an email? Are we introducing ourselves in person at a conference just to say thank you? And then doing that repetitively so people remember a face or a social media handle. It does make a difference. And making sure that we're connecting to those networks, because again, that's how those papers get written. That's how that implementation science happens. That's how these podcasts happen. And then we can get them out in a free open access space, part of the FOMED community, which is free open access medical education, which I believe in as part of the emergency medicine folks I work with. And at the end of the day, it's just the people who are doing it so well. And it's so wonderful to see, especially we know some of the controversy that happened with some of the concussion documentation that's come out in the past. We've kind of been pushing past that and this collaborative space of, hey, here's how I can help. Here's how I can elevate this other author, this work, and so on and so forth. So it's just a pleasure to see everyone just really come together and play well in the sandbox and just elevate and amplify for the patients and communities that we're trying to serve. So it's just been a pleasure to get to know you, Mario.
It was a pleasure to know you and to speak with you.
Thank you so much. So let's highlight a couple things. We've got 2 conferences coming down the pipe for you, one in October 2025, and then a wonderful world conference in 2026. And then we also have something for your Sports Physio members as well that we'll provide a discount code to your community as well for our 1 or 2 courses or the bundle. So please let us know. You'll have that code as well for your Sports Physio members. And then let's talk about the 2025 and 2026 conference before you head out.
Yeah, it's a pleasure. 2025, we'll have also this year, we have the second joint conference with the Sports Medicine Society, Switzerland. So Sports and Exercise Medicine Switzerland in Lausanne, a variety of topics around structure and function with many international speakers. And the 26th, next year, we will host in Bern the 6th World Conference of Sports PT in cooperation with the IFSPT, the International Sports Physical Therapy Federation. And the program is not yet finalized. We will try to have a really speakers from all over the world, to have also very diverse and interesting conference, and that's it. And then for the other years, we don't know. So there will be probably some younger guys on the board. So let's see. But anyway, we hope that someone will continue with these events. I think it's an important piece in the big puzzle of education, networking, and so forth.
Oh, fantastic. As an American, it was an absolute pleasure to go to Bern and see the people, the taste of food, see the community and the comradeship, the camaraderie, just collegially across the board. You had folks from the US, Sweden, Switzerland, Italy, and it just went on, and Ireland. And it was just fantastic to really have that collegial comradeship. And again, at Concussion Corner on the Academy side of things, we do things bichronously. We have an on-demand component, and then we have a live Q&A component where you actually get to meet our faculty, which is the top 1% who are doing this all over the world. And then you have one-on-one office hours with myself. And it's such a fantastic connection to be able to go do things in person and really just kind of fill your bucket collegially, but then also be able to deliver on the other side of education as well. So again, if you want to have some of the top in-person conference experiences, I really highly recommend anything coming out of Sports Physio Swiss and the folks over there for the 2025 and 2026 conferences. And as we depart, Mario, any thing that you would like to kind of see in the latter portion of your career, anything that you'd like to see built up in terms of, is it, throwing better conferences educationally? Is it, having certain types of research done a little bit differently or in a certain way? What are you kind of hoping to see in terms of prevention and sports injury medicine kind of in the next 5 or 10 years, hopefully, in terms of a progression before we head out here?
Yeah, thank you for the question. This is not an easy question. So I don't know. So I think to see that some knowledge is being applied will be great. Sometimes you hear from colleagues that there are still, you have maybe a colleague who had a knee surgery and he is going to a PT somewhere, and they are still doing straight leg raise and lying on the bed and maybe doing some other stuff. So I will not say this is absolutely bad, but maybe it's not appropriate working as a PT or sports PT in 2025. So, and the same applies for prevention or reduction, injury reduction. I mean, we all know that it's very tough in real world, but let's say trying to apply it, we know there are many examples. It's possible to do something, but it's really the willingness, the passion that you bring into to do it that makes the difference. So yeah, of course you can continue to do research, but there are so many things that are still there that one could use. Yeah, this is one of these jobs that to have the interest and motivation. This is good, but you also need some portion of passion to work. It can be with patient working in the office in New York City and going to a basketball game only, but it can be also when you work with the players of the New York Liberty. So you have to bring into this extra bit of passion and to work and to bring out the best of yourself and for the best of the patient and the athlete. This will be great if more people, many are doing like this, but we know that it's not, others are not. So I would wish that we have more of these colleagues, so that more can be applied in the real life.
You stole my answer, so thank you for that. That was a softball pitch to you, but really though, thank you for that answer because it means so much to me. That's why we have the podcast. That's why it's freely open, accessible to people, because it's like, hey, how can we facilitate next day knowledge translation? And we admire and acknowledge that folks are showing up day in and day out. And at the end of the day, physio and healthcare professionals are in a service industry. It's not the restaurant business, but we're really giving of ourselves to make sure that we can serve a patient in front of us who is suffering. They're either injured from the sport that they love or from being able to play with their grandchildren. And I argue that those are two sports in itself if you've ever raised a grandchild. And at the end of the day, it's like, how can we, elevate and amplify and really exemplify just knowledge to translation and just bring that passion for folks that may be feeling a little bit down walking through the clinic door. And, thank you for, broaching this conversation with me today and our last podcast as well. Mario, where can we find you on social media in terms of finding Sports Physio? Where are you guys posting most these days for socials?
Yeah, you can follow just on Facebook, Instagram, LinkedIn, Twitter, but it's always Sports Physio Swiss. So then we have the YouTube channel, as you mentioned. Yes.
Fantastic. And we'll put all of those links in the show notes to make it easy for everybody. And again, thank you so much for coming on, and we can't wait to see what you do next.
Thanks, and congratulations for all your work and your passion.
Thank you so much. Take care.
Ciao.
And that brings us to the end of part 2 with our conversation with the wonderful Dr. Mario Bizzini. What a gift to learn from someone who has spent over 3 decades elevating global standards in sports physiotherapy and injury prevention. From ACL to the ankle, concussion to collaboration, Dr. Bizzini reminds us that prevention is not just about drills, it's about education, access, and systems level change. Whether you're a clinician in a bustling urban center or working in a rural or underserved community, today's episode was a reminder of our greatest impact comes when we lead with passion and serve with purpose. If this conversation resonated with you, I invite you to like, subscribe, and leave a review on Spotify, Apple Podcasts, or YouTube. Your feedback helps amplify these global voices and gets the important work into the hands of more providers and ultimately into the care of more patients. And if you're ready to dive deeper into interdisciplinary brain first and equity-centered concussion care, visit us at concussioncorner.org and explore our post-professional educational programming at Concussion Corner Academy. As always, thank you for being a part of our Teach One, Serve Many community. Take care.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.